Alistair is a doctor.
It's a doctor of civil engineering. And what do you want to? It's a meeting. Look at it. This is the meeting.
Dr. Popola, you're muted.
Hello?
Okay, can you hear me now? Yeah?
Yes.
All right, wonderful. Thank you very much. Thank you everybody for coming again. Sorry we're about 5 minutes late, but we're ready to start. Ladies and gentlemen, you're welcome to second in the series of our seminar by the Nigeria Society of Engineers in the UK, London branch. You're welcome again. We're very grateful that we're all here today, despite all the problem that's going on in the world in terms of COVID-19. You're all welcome that we're alive, and those people that passed, we wish that so rest in peace. Just a bit of introduction of our organization. The London branch was inaugurated in 2018, the first of its kind to be established outside Nigeria. Nigerian Society of Engineers was actually, originally set up, but now we've got a London branch, and many other branches are currently being set up all over the world. Two of them are also in the UK, the Manchester branch and the Glasgow branch. They're all also been set up in the UK. And one of the main aim of our organization, just to fill you in, is that we're here as an organization of Nigerian engineers, people here to share engineering knowledge and experience that we've acquired in the diaspora, and wanted to share that with our people back home or in the rest of the world. Hence the reason why we're running this engineering series or seminar. We've had many of these seminars in the past, and we've also done a lot of work with schools to encourage young kids to come into engineering when they grow up. And as we all know, for any country to develop economically, they need engineers like us to be able to develop. But as you also know, with this team, we cannot do this thing by ourselves. So we need people like you to join us to continue to be a member of this organization, and many more of the other organizations that has been set up in the UK, like Manchester and Glasgow. We all like to come together and help in building the organization even better. So with no further ado, I'm going to acknowledge a couple of guys I've seen that have actually come in here already. We have Engineer Mohamed Babagana, the president of NSE, and also some of his executives. We also have some people from Koran. This is the registration authority in Nigeria. We have Engineer Chume, Akusim, and we have quite a few other distinguished members of engineering family in Nigeria. And also some members of people who are setting up branches in other parts of UK. They're also here, Engineer Dediron Akusim, and many other people also. So you're all very welcome. And today is a very interesting day because we have a very interesting topic that is very close to all of us, very dear to us in terms of hygiene, water, and so many other things. So we have engineer Dr. Mrs. May Sule. She's an environmental engineer with over 17 years of experience in developing, planning, implementing, and managing relevant program on water, wastewater, sanitation, hygiene, wash, environmental stuff, anything to do with gender, international development, SDG, Sustainable Development Goals. She's done quite a lot of work in that area too. And setting up policy, advocacy, as well as being involved in high quality research. Our research span across urban water supply system, rural water supply, sanitation, water pollution, which is very important to our country, and treatment. The environmental and climate changes or behavior change, which is one of the things we're going to talk about today. Health and neglected tropical diseases, in particular, schistosomiasis. This is a word that's been twisting my tongue for the last 2 days. I hope I pronounced it very well. She had an interdisciplinary research collaboration in countries like America, Europe, Africa, Asia, and Australia. Our work in the past year has also focused on the technical and non-technical socio-economic aspect of achieving WASH. WASH meaning water, wastewater, sanitation, and hygiene. Right. And she's been very successful in this area, especially in the global sustainability development goals agenda. Our goal is in the use of scientific evidence to help inform public policies and improve the life of poor people, especially their right to live with dignity. So with no further ado, also I'm listening to acknowledge another person which I've seen online is Professor Mike Templeton, who have actually worked very well with our speaker today. They've worked together at Imperial College. And we also need to congratulate our speaker because she's so good that Oxford University have decided to ask her to come and join them. So she's going to be leaving Imperial College this month. She hasn't left already to join Oxford University. You have to be good. If you're not good, nobody will ask you to do that. So with no further ado, I'm going to stop sharing my screen and I'm going to ask our speaker, Engineer Dr. May Sule, to share her screen. And she's going to be talking about the interface between water, sanitation, hygiene, engineering, health, and behavioral change, using two very important case studies. So, Engineer Dr. May, please take it away.
Thank you very much, Dr. Popola, for that introduction. I was not sure it was me you were introducing there, so I'm humbled. Thank you very much. And I also want to thank you for inviting me to come and give this talk together with the NSE London UK Executive. It's an opportunity and I'm really very grateful. Thank you also to all who have tuned in to listen. I know you should be doing other things on a Saturday, but you've taken time out to come and join, so I'm really very grateful. I'm going to go through my slides now, and I hope you can all see it.
Yeah, but you seem to be on the final slide, so you need to go to slide 1.
So that's slide 1. Does it show my background now?
Yes, yes.
Okay.
Okay.
Yeah. So Dr. Popola has already kindly introduced me, so I don't have much to say again. But just in brief, my background is around water, sanitation, and hygiene. Like he has said, I've carried out research. I've been involved in industry in terms of operations and maintenance of urban water supply systems. That's this is a picture of Lower Usman Dam Water Treatment Plant in Abuja, where I manage the operations there.
We are not getting the signal. It's like the network is poor, yeah.
Okay. Are many people having that problem?
No,
I can hear you.
Okay.
I can hear you loud and clear.
If somebody's having a network problem, it will be local to you.
Okay.
I think, yeah. You go on, Dr. May.
All right. Okay, so this is a picture of, this is a water treatment plant that produces 240 million liters of water per day. But unfortunately, we're disposing of our sludge from the sedimentation basin into a downstream river, as you can see here, which was polluting water downstream for the people who had their source of water locally in the ponds there. But Fortunately, we were able to channel this water to a new sludge treatment plant that was constructed. So I just want to say, if you believe in something and you want to make a change, you'll be able to do that if you make up your mind and you set out to do that.
Yes, we can
also work on rural water supply, rural sanitation, environmental sanitation, and hygiene as well. So just to tell you very quickly.
I'm just gonna, give me a second. I'm just gonna mute everybody because some people are still talking.
Okay. So I just want to say that these topics are not in all of our areas of interest, but because we are all interested in collective public health, I think it will do us all good. I also apologies in advance because some of the slides are quite wordy, but it's necessary statistics. And please eat your lunch in the first 20 to 25 minutes, because I might say things that will make your food no longer appealing after that. So please try to eat your food within the first 20 to 25 minutes. The first case study is schistosomiasis control. And I'll be talking about a project called Water Infrastructure for Schistosomiasis Endemic Regions. It's a 1.5 million project that was funded by GCRF, the UKRI, and the EPSRC. The PI, who is the overall head of this project, is Professor Michael Templeton. And the collaborators were Imperial College London, Natural History Museum, Addis Ababa University, National Institute for Medical Research, Tanzania. And we also partnered with Acting for Health on this, or using theater and role play. And that's because as a Nigerian and as an African, I know how much you can tap into community nuances to get your message across in terms of behavior change. We as Africans love stories, folk tales in life with life lessons in them. We've turned out to be the best writers in the world, from Chinua Achebe to Chimamanda. And so it was a good idea to partner with Acting for Health in that respect. It is also an interdisciplinary team with water engineers, parasitologists, snail experts, and anthropologists as well. The main objectives of the WISER project was to determine the effectiveness of water treatment processes at removing or inactivating saccharine in a rigorous and extensive manner. To go ahead and develop and validate chip biosensors for detecting saccharine in water, and also to consider current water contact behavior and management practices, sanitation, and other challenges that we may face in some case study communities in Ethiopia and Tanzania. So in our department in Civil and Environmental Engineering, we dealt more with, I was also the research lead for Objective 3 here. Many of us, as Dr. Popola said, the name is tongue twisting. The other name that we call it is bilharzia. It is a
You're muted, May.
Yeah, okay.
You're still muted, May.
I'm still muted, okay.
Now you're not.
Okay, all right. Okay, so schistosomiasis is an NTD. An NTD is a neglected tropical diseases. They're a diverse group of communicable diseases that are in the tropical regions. Mainly, they are in 149 countries, and about 1 billion people are affected. So there are about 20 NTDs generally. But the NTDs that are very relevant to water sanitation and hygiene are schistosomiasis, onchocerciasis, soil-transmitted helminths, lymphatic filariasis, which is elephantiasis as we call it in Nigeria, and trachoma. So these diseases are thousands of years old. It's a disease that spreads from humans to snails and back to humans again. It's just a vicious cycle of human infection to snail. And it's also from skin contact with water that contains the infected snails. It's quite a very tricky disease to control. The parasites that emerge from the snails and infect humans are called saccharia. That's a picture of it I have here. If you look at it, it's like a fish. So this head is what penetrates your skin pore, and then the tail falls off. All right? When it goes through, it gets into your skin, it gets into your bloodstream. So it's also, there are over 200 million people infected in Africa, 200 million in the world, you know, about 200,000 die each year. Africa has the highest disease burden, about 90%. You can see Nigeria here is also highly prevalent. It's highly endemic to schistosomiasis. The symptoms include bloody urine, diarrhea, abdominal pain, enlargement of the liver and spleen, inflammation and scarring of the bladder, like you can see in this picture here. In children, it causes anemia, malnutrition, and learning difficulties. And there's a current desire to move towards elimination of schistosomiasis. There's a new WHO NTD WASH guideline for 2020 to 2030 to go in line with the SDGs. And that's because they have realized that to tackle the NTDs, WASH is very important, whether it's in terms of behavior, toilet use and maintenance, or hand washing, personal hygiene, constructing toilets, or when you actually need clean water to even take the drugs that are being provided. And that's why the WHO is having a very keen interest and placing so much importance now on WASH and NTDs. So this is the life cycle of schistosomiasis. We have the schistosoma, like when the snail, the head goes into your body, it ends up maturing and hatching into a male or a female species. These male and female species get married, they partner, they become paired adults, and they begin to release eggs. And these are the eggs that are in either the bladder or the intestines. And so when people, if it's in the bladder, you urinate blood. When it's in the intestines, especially the last intestines, you have blood in your feces. These eggs, when they find their way into the water, because people openly defecate, or because some people just go by the river, or they have very poor sanitary conditions in their homes. So when the rain comes, it washes everything into the river. The eggs turn into the miracidium, and this miracidia is what gets into the water snails. When it gets into the water snails, it progresses into sporosis that eventually turn into the saccharia. I hope my cursor is showing you as I'm going through. And that's a saccharia like that I showed you that penetrates the human. And so the cycle continues. It's just a vicious cycle of poverty and disease, you know. So why is WASH and other interventions important? If you look here, this is the paired adults. If you want to destroy these paired adults, you use your drugs. There's a drug called praziquantel, which is very effective, but it's not a vaccine. So if you take praziquantel, after 4 months, if you go into the water again, you still get infected. So it's discouraging people to continue to take the drugs. If you want to destroy the eggs in the water, you provide toilets. And it has to be universal sanitation coverage. Because if you have good toilets and adequate sanitation, all the eggs are contained in the toilet and they eventually die off. If you want to destroy the water snails, you use molluscides. This is effective, but it's not highly desirable because of the environmental consequences. You destroy other ecosystems. So that's not really highly ideal. Then if you want to destroy the saccharia here, you use water. So you can see the relationship between water and sanitation and schistosomiasis as a whole here. So we need to provide water for all water needs, drinking, washing, recreation. But the difficulty is occupational use. You know, we have paddy farmers who farm rice, or fishermen who go in, and that's their source of livelihood. So we have to think around how we can protect those group of people, even after we have provided water for everybody else to use, for all their use. And we could just dig new wells and access groundwater, but in many cases, we still need to treat the infested water somehow to make it safe. And because this water infection is through the skin, we have to know how to change our behavior, especially people who go into the water, like children who just go into swim and they keep having recurring incidences of bilharzia or schistosomiasis. And communication is very important in this respect. For our wiser research, we have recommended 4 types of water treatment: chlorination, sand filtration, and a possibility of riverbank filtration, ultraviolet disinfection, which we're still carrying out experiments on, and then looking at storage. Analysis from previous studies shows that saccharide die out after 72 hours. So we can encourage people in communities to have like 2 storage containers. You have one stay for 3 days while you're using one, and you interchange them that way. But a lot of community members don't have the space, and they don't even have the money to buy storage containers that will last for 3 days at a time. So that's also a concern in itself. When we also advise on sanitation options, there's what we call the sanitation ladder. At the bottom here is what we call the basic pit latrine, which contains the feces. At least it's a protective way of having the feces in one place. Then we go up the ladder, we have the ventilated improved pit latrine, which we call the VIP latrine. It's much better. It has a net that traps flies, and it's also it's very good in that it doesn't smell. We have the pour flush latrine, and then we have the septic tank. So depending on your income and what you can afford, so it has to be appropriate and affordable to you. But we in the communities that we work, most people